We have over a 300-point checklist that occurs every single month when we go into that facility. Our goal is to reduce communicable disease. Our goal is to reduce discharge to the hospital. And our goal is to implement those policies and those protocols and those procedures to give you a feeling in your head that you know that you're taking the best possible care of these patients and that this is a continuous quality improvement method. It will help reduce liability cost. It allows you to have self-monitoring and allows you to present information to outside parties, which includes governmental policies and governmental agencies, as well as people considering your facility as a facility where they might put somebody. It also allows a positive review to occur. That's one of the hardest things that happens is, how do I generate positive reviews for a skilled nursing facility? Well, it's really hard unless you're in the facility talking to the patient and eliciting the information. And that's the purpose of our checklist. When we have our team go in and they're doing their monthly 360 screen of the patients in the facility, they're talking to those patients. And as they're gathering that information, they're gathering the snippets of positive and negative information. And on the positive side, you can use that as part of conveying that positive information to other people considering your facility. And the negative information, you're using it to get better, because it's a process of continuous improvement. You know, when they started out with the iPhone, it wasn't perfect. They did iteration after iteration after iteration after iteration, and they kept getting better because they had amazing feedback. That amazing feedback is sometimes missing in facilities because it's buffered through the management team, who has maybe their own agenda. And it's not that it's a bad agenda, but they're focused in on employee retention. They're focused in on that JCO. They're focused in on the big things. And they may be missing some of the little things that occur that have a big impact in the perception of the family or the employee or the patient. And so sometimes it's the little things that these people feel disempowered with. They feel like, well, if they don't even check the corners of the rooms, or if the temperature's too hot in the water or it's too cold, you know, these little things, if they feel like maybe, you know, the food quality isn't as good as it could be, or nobody's realizing that, you know, that the patients don't smell perfectly. And that's, you know, how do you get to a smell test by looking? You can't. You have to go to the facility to do a smell test. And when you get to the facility and it smells like fungus on that patient, it's probably fungus. And it's not stuck on that one patient. It's probably through the whole facility. So those are the things that you get ahead of, that you don't want to wait till you have your annual check by a state or federal agency. We want to be well ahead of those situations. So just to refresh, any report generated by us is protected by attorney-client privilege. It allows you the time to address the situation before it becomes litigious. It's non-discoverable work product. It buys time so that you can do an appropriate internal investigation, and all of our transmittal is to your attorney. And we work with your attorney to come up with resolution as well. It's the most important thing that we're able to do for you is to buy you time so that things can be taken care of. Because we know that everybody wants things to be done right, but sometimes, one, if you don't know it, you're not going to be able to fix it. And two, sometimes if it's a federal agency that comes in to do the analysis, it's already too late. And you're not protected by work product at that point. That you're responding to a federal agency saying, hey, you did this wrong and we want to punish you by this massive fine. Whereas if you already know about it, you've already fixed it, it's highly unlikely that you're going to sustain a fine. So what are we and what are we not? Well, we're not an ARCO. We have a data non-retention agreement. We're not a Medicare contractor. We don't get paid by Medicare. We're not an insurance product. We're outside of ERISA. We're not a laboratory. We certainly use lab information and we collect for the laboratory through our Missouri protocol, but we're not the lab, so we're not making the money off the laboratory. We don't provide direct medical service. We coordinate care. We're an independent organization. that coordinates care with other vendors. We're agents that work with your legal team. We provide certification for your facility, and we provide you the comfort for patients and the knowledge that you know that you're doing the best you can, and the knowledge from the patient standpoint and their family members and your employees that, hey, there's somebody here that's looking out for us and we can report confidentially. And we want people to have an amazing, positive business experience. And that's the purpose of why we're here. We want people to have a positive experience with you. That's what's going to make the biggest long-term difference for everybody involved. So how does this work? The QR code is posted at prominent locations on doors in areas that are patient care areas. Each facility has a unique QR code, and it goes straight to a form. And in that form, you can fill out a positive and negative piece of information. So you can do both. Once you fill that out, that form is completed and it's immediately transmitted to our legal team. And the legal team gets a hold of it, they scramble it, anonymize it, and send it immediately forward. They're not there to report this to a federal agency. This legal team works on your behalf. They're contract. And now you can use our team in its entirety, or it can go entirely to your attorney. A lot of times, your attorney may be a lot more expensive, but we can connect you to attorneys that will appropriately get the data and extract the actionable information and do it in a very efficient way. CareGuard allows that transmission of data, and then on our side, that information is eliminated. As soon as we've got a handshake that your attorney has received it and we've reported it because we work for them, or for the attorneys, and we've produced this product for them, it's shredded from our side. So it's no longer discoverable. At the same time, you've got a certification on your website that says, hey, we're CareGuard certified. And it allows you to differentiate yourself from other people. And from the standpoint of the employee and from whoever's doing the reporting, they know that that reporting was done in a confidential way, and it's done in a way that doesn't confront the local administration. I mean, think about it for a second. If you've got something that is just gnawing at you, and it bothers you every time you come in, but you know the management there, and you wonder, if I report this, are they going to treat my loved one not as well? Are they going to take it out on the employee? Are they going to do something that is not appropriate? Because human beings are human beings. We understand that life is not perfect. This allows it to be done in a non-confrontational way, and it allows your attorney to wash the information and provide a cleansed piece of data in an appropriate way to make a big difference for the outcome of that patient. And that's the main thing. We want to get the information to the right place so things can be changed, but we don't want it to be confrontational, negative. And we want the information to be reliable. And that's why we have the component of data collection as in terms of pharmaceutical information on the patient and as in terms of biometrics. And we want the patient to have a long health span and a long lifespan, and long lifespan in your facility, so that you've got the revenue long term to justify all of your investment and to make sure that it's done appropriate. There are 2 stickers that will be on your site, and these are live. And so once you enroll, you'll get a certified sticker, and after a year, it will expire. So you renew it in a year. This is not an expensive proposition. What it does is it allows the family of the resident to know that you've gone well above the usual standard of care, and that you are screening for metabolic health. You're screening for balance and stability. You're screening for communicable disease, that you have a reporting mechanism that's non-confrontational, that the outcome is really important to you. And that may make the difference between somebody deciding to use your facility or just a JCO certified facility that is just a routine facility that gets looked at every year or every other year. Your facility gets looked at every single month, and make sure that we've got documentation and enhancement in the long-term outcome of these patients.